The goal of our project was to increase compliance with proper labeling of OR syringes in our operating rooms by 10%. This means that the medication name, concentration, expiration date, and the initials of the provider would be correctly labeled on them.
An important component for increasing compliance with syringe labeling was to determine what prevented our colleagues from being compliant in the first place. To assess this, we sent out a survey via email to our colleagues to see how important they viewed syringe labeling and what prevented them from being compliant. As you can see, most of our colleagues did feel that correct labeling was very important, but their reasons for not labeling were a little bit surprising. Most ran out of time. Some only lacked supplies, such as a marker in the operating room, while others only labeled the syringes that they deemed important. These were important for us to determine so that we could seek ways to improve compliance by looking at the environment, materials, or people that play a role in syringe labeling compliance.
To attack these root causes of syringe non-adherence, we did 4 PDSA cycles. Our first cycle was to simply pop into operating rooms, audit the syringes to see if they were labeled, and to discuss the importance of syringe labeling to the provider administering the anesthetic. Our second cycle was to place simple yet gentle reminders on the anesthesia carts to have the provider please label the syringes. Our third cycle was a bit more serious. We placed posters in each of the operating rooms reminding people the importance of labeling their syringes. We also placed a poster in the anesthesia provider lounge discussing the literature and statistics behind the importance of labeling syringes. Finally, our last PDSA cycle, we placed Sharpie markers attached to all OR anesthesia carts to help the provider label syringes. We showed even more interesting results. We were able to demonstrate with our data that there were significant differences between OR room and the percentage of syringes being labeled correctly. This difference had no regards to the time of day, that is, it was just as likely to occur in the morning or in the afternoon. Throughout the study, OR rooms 1 and 11, which are our CV and trauma rooms, showed that they had a higher than expected rate of syringes being mislabeled. Conversely, in OR rooms 5 and 9, which are our general and neuro rooms, there was a lower than expected rate of mislabeled syringes. So for whatever reason, the providers tended to label syringes more consistently in these rooms.
And that's the big...
What was most exciting, however, was that we were able to show that at the conclusion of the markers intervention, which was our PDSA cycle 4, we showed that there was a statistically significant decrease in the total amount of incorrectly labeled syringes in our ORs.
The table on the right shows a descriptive comparison between the correctly labeled syringes and the time of day and the OR room number. As discussed previously, we saw an increased rate of non-compliance in OR rooms 1 and 11, while rooms 5 and 9 had an increased rate of correctly labeled syringes. However, time of day did not have an impact on a correctly labeled syringe.